Hi y'all, this is Stephanie McBride, and I'm here to share a few tips for you on how to use essential oils during pregnancy. I'm going to talk about my favorite oils that I find really indispensable during pregnancy, and also a few that you should avoid at certain times. And just know that this is incredibly empowering for people to bring into their lives at this time and very, very safe. So there's just so much fun you can have with these, and also come out of pregnancy on the other end being more confident, more relaxed, more energized, having a very healthy experience with it all. I wish I would have had these during my own pregnancy. I brought them into my life after a lot of postpartum issues, and it completely transformed my health to do so. And since then, I've been completely invested in this topic and trying to help share this information with others. So if you like the information, if you get benefit from it, pass it on. Let's get more people using these. They're such a great natural alternative to suffering or going with something more medical that has additives in it. So first of all, I'm going to talk about one of my very favorite oils during pregnancy, and that is bergamot. It's a unique oil among the citrus oils because the scent is both floral and citrus, and that has the combined benefit of helping us to relax but also energize us. And what's better for pregnancy than having those two things at the same time when we're tired and stressed? So great oil. Just a quick note that it is the most sun sensitizing of the essential oils, and we're most sensitive during pregnancy. So make sure if you're using this topically to cover up with clothing or just apply it at night and avoid the sun exposure directly to your skin if you live in a place with sunshine. Okay, another oil that I really love during pregnancy is black pepper. And this is one that can also be used in labor for labor pain. But it's great during pregnancy to have for a couple different reasons. One, again, it's very energizing and it can evoke the emotion of courage. So those are nice things, but also it's one of the best ones for penetrating deeply in the body and helping with things like constipation or other digestive issues. And also it can help with neck and back pain and labor pain. So I think that those things all come up a lot just naturally during pregnancy. And it's a really nice one to add to a massage blend for such purposes, or even like a digestive blend can be massaged into your abdomen. Any of these you can smell straight from the bottle or put a drop in your hand and smell out of your hands and get the aromatic benefits, which are things like feeling more energy, helping to change your mood and emotions, clearing your sinuses. And you can also use it to help build your immune system. The topical uses are probably broader. There's a lot of them that are used all the time. During pregnancy, I really like baths, and you can add these to baths with an emulsifier like salt, or I like to use like whole milk or cream. I mean the kind you put in coffee, not the lotion. And just using like a tablespoon of something like that or glycerin and mixing about 5 drops of oil and putting in your bathtub during pregnancy is amazing. So that's one topical use. Apply during massage. Everyone loves that. You can do self-massage if you don't have someone willing to help you with that. That's another great use. And like I said, black pepper, bergamot are both good for those things. And you can also just apply them to wherever over your body you feel discomfort. So if you have indigestion, for example, you can apply them to your chest. If you have diarrhea, you can go in a counterclockwise motion over your abdomen. If you have constipation, go in a clockwise motion over your abdomen. But really, you don't even have to know that. That's just a little added, support. You can just put them on your abdomen where you feel pain. So it's just kind of fun to learn all these intricacies and to really get comfortable using them. And it doesn't take much. It takes like one application and then you know how to use it. So I wanted to share also just a couple oils that I don't recommend during pregnancy, but are really good at other times. One of them is Clary Sage. This is such a beautiful sedative oil. It's the most sedative oil that we have in our repertoire. And it's really amazing for postpartum hormonal balance, for regulating contractions and helping with labor pain. But we want to wait until a mom has come to term in her pregnancy and has been given the green light, like go ahead and do stuff to try to start labor, which means the baby's in the proper position, everything's set in your body to go, then you can bring Clary Sage into your life. And that's just because it has the effect of stimulating uterine contractions. So we do want to save that until we're ready. And another one that I love, but I don't recommend so much during pregnancy, is oils with methyl salicylate. So deep blue and birch are examples of these. These are incredible oils during labor for labor pain and back pain and in postpartum. They're great. And actually, it's okay to use these with moderation in pregnancy, but do keep in mind that people who are advised to avoid aspirin should use a lot of caution, and that's almost everyone pregnant because the blood doubles in volume during pregnancy. We just don't want to mess around too much with thinning the blood, which is what these oils do. There is some interesting research out now about methyl salicylate and aspirin helping to prevent hypertension during pregnancy. So that's exciting, but there's not enough research about that for me to be comfortable saying people with those conditions try these oils. I don't know. Maybe it's good for you. I'm excited to hear about more people, more research on that topic. But in the meantime, you can replace those incredible oils during pregnancy more often with things like wintergreen and ginger and black pepper, and you will have an awesome effect of those, especially if you mix them with something like lavender that's more relaxing. So that's what I have to share today. Look out for tons more great tips on all my resources, and I hope you have a wonderful day. Hey, thanks for watching my last video. I love teaching people how to use essential oils safely and effectively for pregnancy, postpartum, infant care, even labor and delivery, and so far beyond all of that as well. I have numerous resources that I've put together for you to share this information and knowledge that I have gained over so much study, personal experience, clinical studies. It's really valuable to you, and I can't wait for you to get started. There are a few ways that you can jump into this. The first, most simple way is to get your hands on my new book called Essential Oils for Maternal Wellness. This is a great, easy to read guide that walks you step by step through everything you need to know to integrate essential oils into your pregnancy and beyond. If you really want to amp up your expertise and learn everything I have to share, you've got to sign up for my e-course. The link is below in the notes, as well as the link to the books. So once you do that, you will earn a certificate of completion or CEU continuing education credits if you're a birth professional in the United States. I have also wonderful things for you if you've never gotten your hands on therapeutic quality essential oils. I've actually handpicked the oils for 3 incredible kits that I offer you at wholesale prices, and what is included is my personalized, very loving expertise and guidance. So I will have a personal relationship with you as my customer and help you to get to know how to use these oils. And I also have programs for people who are already in the health field or would like to teach others on this topic. So please ask me about my business training and additional credentials and I guess just educational and business opportunities. Thanks for listening, guys. Keep watching my videos. Be well.